Hi everyone, this is Farah and I'm here at the Health 2.0 Conference Dubai. I have here with me Dr. Mia. Welcome. Can you please introduce yourself and your organization?
Hello there, my name is Dr. Mia Eisenstadt. I'm a psychologist and researcher, and I am the founder of the Fatherli app, which is a new app for fathers to support them with their mental well-being and also their parenting, and give them a sense of community with other dads and connection to coaches and experts if they need them.
So I'd like to congratulate you for the Outstanding Leadership Award. How does it feel to receive that recognition?
It feels really great, actually. So sometimes it can be a hard slog as an entrepreneur or trying out a new idea. So it's really lovely to be given this award, and also to be with all the other awardees as well. It's a great collection of interesting and amazing leaders.
So tell us a little more about Fatherly. How does it support fathers?
So Fatherly is a free app, and there's many different groups that fathers can join around topics that are relevant to them. So if they're a stepdad or a single dad or a married dad or a dad that loves running, they can join groups with other dads that they have in common, have things in common with. And then there's a forum where dads can post and introduce themselves and ask questions. So sometimes people ask particular questions around parenting or around their relationships, and then they can get support from other dads, and then also from experts, parenting experts and therapists. They can also access coaches through the app, and they can read sort of evidence-based research around topics around parenting, well-being, men's health, and relationship topics. We also run a group on Zoom once a week where it's men only, so it's just for dads to come and be in a supportive environment with a facilitator where they can share what's going on for them and receive support and guidance, and just be part of a community, really.
And why do you believe that it is important to support fathers?
So historically, fathers have been really overlooked in parenting support, and what we find in the research is that there's many really important parenting programs, but they tend to just be attended by mums. 90% are attended by mums, and obviously dads are really important, and especially since the pandemic, dads are actually spending more time at home with their kids and doing more childcare. So it makes sense to support dads as well as to support mums. And then the other thing is that there are a range of well-being issues that dads can experience, like stress, burnout, difficulties adjusting to the role of becoming a dad. And obviously, becoming a parent or a dad is a big commitment, and it's very important to support parents, both the mum and the dad, in that early phase, so that you set the family up and the child up for a long-term supportive environment.
That is incredible work, honestly. Thank you for that. And can you tell us, as a woman in tech, how has that been for you?
Yeah, it's been a real journey, actually. So I love being a woman in tech, but sometimes I do feel like a minority, and I do want to support more women in tech, and especially the younger generation. And I think as time goes by, we'll have much more women in tech as well, and more women in AI and machine learning as well.
For sure. Can you tell me more about your experience at the conference so far? How has it been? Did you network with people here?
Yeah, I've really enjoyed networking with people here, and I ran a panel on approaches towards stigma, towards mental illness, and so there was five of us, and I really enjoyed getting to know everyone on the panel in the run-up to the event, as well as here at the event itself. I've also enjoyed hearing about a lot of interesting topics to do with helping new medical innovations get to market, and also I'm very interested in sort of the regulatory environment, and obviously we're all interested in the topic of AI, and it's been really interesting to hear different perspectives on that, particularly within the health field, and applying AI in the health field to sort of solve health problems has been really interesting.
And what is your opinion? So I've spoken to several people about AI and the health industry. What do you think the AI in being integrated in the health industry is going to look like? Do you think it's going to be something positive or negative?
So we have a problem in mental health in that there's not enough coverage. So many people have mental health needs and they can't access mental health support or therapies, or they either can't afford it or they don't want to, or there's stigma. And so, so I work. One of the reasons I work in sort of in the app digital health world, and this applies to AI as well, is that there's an opportunity to increase coverage. So if you free up a therapist or a doctor by AI taking on some of the work that a doctor or a therapist would be doing, then you can potentially serve more people. So I think that's a really compelling argument. And then secondly, I do believe that it all needs to be supervised by humans. So and I just think that that is a possible thing to do. It's obviously very difficult, and there's a lot of worry and concern about it. But I think given the investment going into AI in both in America, in China, is sort of the next big sort of huge economic promise for the world economy potentially, that then there should be equally investment in regulation and oversight, just like there is in GDPR and sort of the regulation of data and individuals' data rights.
And now, if anyone would like to reach out to you to talk about some more things related to, the health industry, and to ask you about your business or to learn more about that, where can they find you?
Oh, absolutely. So I'm on all the normal channels, so LinkedIn, Instagram, and on Twitter as well. So yeah, feel free to reach out to me. I love collaboration, and if you're a dad and you're interested in the Fatherli app, feel free to download it and join our community of dads, and you're also welcome to give us feedback as well, because we're still a new product and trying to understand what dads need and what's most helpful to families.
Brilliant. Thank you so much, Dr. Mia, and congratulations again.
Thank you. Thanks very much.